All right, this is our third and final screencast for week number 3, and this is a new chapter in this textbook, one that was not there when I last taught this class. It's called Beyond the Binary: Rethinking the Social Model of Disabled Sexuality. And so let's explore a little bit of the chapter. I think when we think about providing rehabilitation services for our patients, we're oftentimes, if you're a physical therapist or an occupational therapist, dealing with the physical. That physical may impact the psychological. Of course, this textbook is oriented towards the psychological side also, and that would take into account the component of human existence, sexuality. And if you think about individuals with spinal cord injuries, chronic low back pain, changes in neurologic status, there is the potential to lose a component of that. And so that could be something that really impacts not only the individual, but the couple unit, the patient and their spouse or partner or significant other. So I'm going to review some of the topics or some of the sections here in the chapter. As the authors write, sex and disability, disability and sex, the two words may seem incompatible. Practitioners, caregivers, family, friends, and society, rooted in what Butler in 1999 called the heterosexual matrix and what disability rights activists and scholars have called the medical model of disability, consider disabled people to not only be broken or damaged, but also incompetent, impotent, undesirable, and asexual. Their inability to perform gender and sexuality in a way that meets dominant societal expectations is seen as an intrinsic limitation and quote unquote unfortunate but unavoidable consequence of inhabiting a disabled body. Many disabled people who have internalized dominant, ableist, heteronormative notions of strength, beauty, sex, and sexuality continue to experience psychological insecurity and distress when confronted with their own sexuality. They may even recount feelings of anger and self loathing when they ponder the frustration, humiliation, and hostility they face. Yet there are many disabled people who consider themselves sexy and fully capable of a rich sex life, and many disabled people are in relationships that they find rewarding. The complexity of disabled people's lives, however, remains largely unexplored and unintelligible to the non-disabled masses. So I think that nicely puts in context, just like in the past, in previous sections, we explored how past views of the disabled, of the mentally ill, how they were treated by the medical establishment and society, how those have evolved over time. This seems to be an area oftentimes people don't like to openly talk about, but an area that obviously is important to individuals and, again, society, maybe even some medical professionals aren't interested in exploring or discussing. There seems to be a greater awareness and individuals actively researching and studying this area in order to better help people. Now, in reflecting on the complexities of those who are disabled and their sexuality, a series of questions posed by Butler in a book called Gender Trouble become equally relevant to disability scholars. These questions being this: what will and will not constitute an intelligible life, and how do presumptions about normative gender and sexuality determine in advance what will qualify as the human and the livable? In other words, how do normative gender presumptions work to delimit the very field of description that we have for the human? What is the means by which we come to see this delimiting power, and what are the means by which we transform it? In the end, the means through which we see the delimiting power of normative gender presumptions are deeply rooted in dominant notions of quote unquote ability or lack thereof. Transforming the human and the livable, therefore, requires us to move beyond the simple notions of disabled and non disabled. We must move toward a standpoint that Davis in 2006 has called dismodernism. We must move beyond tolerance, beyond inclusion, beyond the acknowledgement of non-normative sex and sexuality, eroticism and desire. In short, beyond the binary. The future landscape of the human and the livable must be informed by a new discourse that resurfaces the intellectual field on which gender, sexuality, and disability become politicized, materialized, and knowable. And so I think what the author is trying to get through here, and what some other researchers are trying to get through, is that we have preconceived notions of what sexuality should be, and oftentimes we think about that in the context of those individuals who are able-bodied. So get rid of those preconceived notions. Try to envision or have not openness, but an understanding that those who are disabled still have the same drive and interests and needs that those who are able-bodied that they have, and be open to understanding the pursuit of those needs by those who are disabled. And that if you're a rehabilitation counselor, how can you help somebody who has a chronic illness or disability, help them to, I guess, explore and feel comfortable with their sexuality in whatever form that it takes, as long as it's healthy and is among consenting adults. The institutionalization of disability studies and the proliferation of a vibrant and dynamic disability culture, both of which have their roots in disabled activism and the social model of disability, have given rise to a whole new subfield, disability sexuality studies. Starting in the 1980s, feminist disability scholars and those researchers and activists committed to a social model of disability began to deconstruct dominant assumptions concerning disability sexuality. Although still acknowledging the embodiment of disability, they began to highlight and analyze the social, cultural, ideological, and environmental barriers to disabled people's expression of their sexuality. Unlike previous research, which was conducted in a clinical setting by rehabilitation specialists, medical professionals, and psychologists, the new disability and sexuality scholarship draws on everyday lives of disabled people. Rather than focus on the perceived trauma caused by individual dysfunction or an inability to perform, the new research explores disabled people's sexual lives in their own words and on their own terms. There is mounting evidence that shows that many people with disabilities lead positive and fulfilled sexual lives. Theirs is a sexual history, though, characterized largely by oppression and discrimination. There are stories of abuse and rape among the institutionalized men and women. There are also stories and evidence of the larger non-disabled population perceiving disabled people as either childlike, asexual, and in need of protection, or that these individuals are potentially hypersexualized and need of being controlled. In their effort to empower themselves and their disabled subjects, most disability activists and scholars fall short, according to the author, of challenging what Butler, in her work on gender and sexuality, has referred to as the naturalized knowledge that operates as a preemptive and violent circumscription of reality. As other scholars have noted, the social model of disability, which emerged out of a highly politicized, male-dominated activist culture, assumed white male heterosexual norm that mirrored larger societal norms. As a result, much of the disability sexuality research has also assumed gender normative heterosexuality. This can be seen most readily in the research on disabled women, which tends to focus almost exclusively on dating, marriage, reproduction, and parenting. So again, I think what the authors are trying to get across here is that some of the research to date has been limited because of the lens in which the researchers were conducting the research. And that lens doesn't take into account the spectrum of representation of human sexuality for adults. And does that represent that it occurs in a married situation? Does it represent that it occurs in monogamous, non-married situations, non-monogamous situations, heterosexual, homosexual, pansexual? And so researchers, I think, are trying to explore this, understand this, and ultimately do so to help those individuals, again, who have disability, to be able to incorporate sexuality back into their human existence if it was lost as a result of their chronic illness or disability. Now, this next section here, again, the textbook chapter author's words, not mine. This individual envisions a future in which there are no disabled sexualities, only human sexualities, a world in which difference is what we have in common, a world where limitation, interdependence, and reliance on technology are the norm, where technology is not separate from, but rather part of the body, where both the body and identity are not fixed, but malleable, called dismodernism. Put simply, it is a world in which we move beyond the rigid humanistic ideals of enlightenment and the equally constraining identity politics of the postmodern era. So, a lot potentially to unpack there. And if you have additional interest in this chapter, I would encourage you to review it. I guess a question I'll throw out there is, how many of you in practice have had patients highlight or discuss the challenges of sexuality for them as a result of their chronic illness or disability? I can't think of anybody off the top of my head from my 24 years of practice and research that's brought that up. Probably because it is a topic that many people don't like to discuss with individuals that they don't have a close, intimate relationship with, or that they feel like wouldn't get them anywhere. And that would make sense. I don't know that if I was going to a physical therapist, I would bring up that topic myself. I would rather want to talk with a medical doctor or whomever my primary care provider was and get a referral to a healthcare provider, whether it's a psychologist or somebody else that has expertise in that area and that could help me. But again, this chapter is to highlight that our patients do have human sexuality as a need. And if you're working with somebody in a holistic way, that is a consideration. If you're doing research, again, it is a consideration.